Go.
In this video, we are going to demonstrate proper suctioning techniques. Suctioning is required when you hear gurgling in the airway, and it's often after the patient has vomited. You use it because fluids or secretions in the airway could be aspirated into the lungs, and the suctioning device can help prevent that. When you're doing suctioning, it's important to pay attention to the personal protective equipment that you're wearing. Gloves, glasses, and mask are preferred. In this video, our demonstrator, EMT, does not have these items on, but just visualize that they're there. The entire suctioning device is composed of several parts. There is a power source, which consists mainly of an on and off switch, and when turned on, it's quite loud. The power source is connected to a canister, which serves as a reservoir for the material that is suctioned out. And the canister has multiple plugs that can be attached to other things. You can attach additional reservoirs if there's a large amount of material that is being suctioned out. And it's also, the most necessary part is the tubing that is connected to that is going to the patient. The tubing is another important aspect of the whole suctioning process. It's important to remember not to kink it, otherwise the suction could be rendered ineffective. And it's also important to have a container of clean water nearby, so that in case there are any chunks of material that get clogged in the tubing, the water can be used as an attempt to flush it out. And the final aspect is the actual suction tip. The most commonly used one is the rigid tip, also called a Yanker tip or a tonsil tip, although a suction catheter is another option. It's softer, and it's used often in stomas and for breathing tubes. And in cases where large chunks of material are being removed, it might even be better just to avoid the tip altogether and just use the tubing, because the opening is a little bit wider normally. So I'm going to go over the techniques used for the actual suctioning process, and then the EMT will demonstrate them. So on the rigid tip, you'll see that on the handle there is a small hole. So when the machine is normally turned on, there's no actual vacuum at the end of the tip, so it won't actually suction anything out. So the EMT has to cover the hole, which then creates suction at the tip. So yeah, when you're actually suctioning, you have to make sure to suction only on removal. So you insert the tip without your finger covering the hole, and you want to make sure you don't insert it any farther than you can see, because you want to make sure you have control of what you're suctioning, and if you push it in too far, you might stimulate the vagus nerve, which could slow down the heart rate. When you're ready to suction, cover the tip, and then slowly remove the suctioning device. You want to make sure you don't suction for any more than 10 seconds, as it could cause hypoxia in the patient, which is a lack of oxygen. The preferred position for suctioning is the recovery position, because again, suctioning is often required when the patient is vomiting, and in the recovery position, it minimizes the risk of choking on the